Transformation. Week 1 to 2, morning wood returns, spontaneous erections. That's the first libido return of the libido. Week 2 to 4 is stronger erections, desires, and better orgasms. Even rock hard erections ensure shorter refractory period, meaning you're ready to go again faster. Month 2, I would describe this as horny as a teenager again. So in short, Gabergoline. This flips your prolactin break, right? So the prolactin is a hormone that affects your dopamine system. You know, I've heard about the dopamine. It's a transmitter that is for kind of satisfaction and so forth, the neurotransmitter by the brain. So prolactin is a hormone from your brain that actually controls this. So if you're having too much of it, we can control this with GABA. Let's call it GABA, right? So Gabergoline, a dopamine D2 receptor agonist, originally was discovered for Parkinson's disease and for people with hyperprolactinemia, meaning they're producing more prolactin than they should. And this can happen. And if you're not measuring it, guys, you will not know. So that's an important hormone to ask your doctor to measure for you. Dose in medicine, when we give it to you guys, it's like 0.2 to 0.5 milligram twice weekly. Effect of the serum on prolactin reduces it by 80%, which is amazing. Amazing for 4 to 8 weeks. Things happen. And that is a publication in Lancet 2003. That is when the morning erections happen and return, mood stabilizes, and wood too. And that's when you stop crying over an insurance commercial. Now, bodybuilders use it too at a 0.2 and 0.5 milligram Monday through Thursday, especially when they're running that 19 NOR compounds. So 2 small trials in 2022, they found that it increases testosterone by 22 to 28%. Free testosterone, 28%. And that is awesome because it also normalizes the prolactin. The best thing about it that we need to talk about is, like, this is something that you got to discuss with your doctor. Risk factors. Risk factors because we're adults. Impulse control. This is number 1. So at a dose of 1 or more, that's when this happened, 1 milligram. So some chaps start discovering the internet poker at 3 a.m. Not a good one. The other problem that I worry about is the cardiac valve. So heart problems. So real but not common at low doses, but it is a cumulative, meaning you use it for a long time, less than 1% increased risk. Again, discuss with your doctor. Orthostatic hypotension, meaning like you get up and your blood pressure drops. So stand up slowly unless you're enjoying hitting the floor. So I think that's another realistic one. So you need to be checking your blood pressure. But the bottom line, it's great for everything else. So if your blood work shows prolactin less than 15 nanograms on cycle, you go on the 0.25, then you can go up to the 0.5. If it's normal, save your money. So just not go to bed early, and that will help you with your prolactin. Either way, get the labs. We're middle-aged people. We're not immortal. Like if you save, like down there, if I saved you $200 on random peptides that you don't need. So carry on, gentlemen. Gabergoline turns a rock bottom libido into amazing rocket fuel mode. So make your sexual performance go from maybe to mind-blowing in weeks. So anyway, the poll that I want you to have down there too, current prolactin levels, if you had it tested, or if not, you need to ask your doctor, is it 10? Is it from 10 to 20? Or is it 20 plus or never tested? So poll down there, please subscribe. Hopefully you liked my video and hopefully it's useful.